Hi everyone. I see many women who come along because they're worried that they've had some unusual bleeding. And then I see some women who don't come along and just live with it. And therein may lie some risk in doing that. So I thought I'd do a video about what types of bleeding you should be worried about and what types of bleeding we think could be considered to be red flags. And that means that you should seek medical attention immediately. Other types of bleeding, I'm not saying don't seek medical attention, but it may not be as urgent. So I'll go through the various types of bleeding. We know that periods should come approximately once a month with a cycle length of approximately between 21 to 45 days. A normal period should last about 7 days or less, but there is some variation with this because we're not all the same. The first type of abnormal bleeding that I'll discuss is bleeding before puberty. So I have done a video about this, which you're welcome to have a look at in more detail. But basically, bleeding before periods start should always be investigated as a priority. And the younger the child is, the more urgent it is that they should be investigated because there is a form of cancer that can present this way or show up this way. And that form of cancer is most likely under the age of 2 years old. So don't ignore it. If your child is bleeding before puberty, then please seek medical attention. The second type of bleeding I will discuss is irregular periods. So I've just said that periods should be more or less regular. I see many, particularly adolescents, but also adult women who come along because their periods are irregular. So this sort of ideal of having a 28-day cycle is not the case for every woman. And if your cycle falls outside of that, it doesn't mean that this is something to worry about. The cycle length is determined by ovulation or releasing an egg. And when you release an egg, you have a period 2 weeks after that. The length of time it takes to release an egg varies among women, so that for that reason, cycle length can vary. Now, if you're having erratic bleeding, so periods that are maybe 2 weeks later you get a period, and then sometimes it's 4 weeks later, and then sometimes it's 1 week later. That type of irregularity that probably should be investigated further. I'll say now that all types of bleeding and all these categories of bleeding, the risk of it being something sinister, which is what we mean by a red flag, varies tremendously depending on the age of the woman. So that irregular bleeding is really common in adolescence, and it is extremely unlikely that it's anything sinister. However, irregular bleeding in the perimenopause should be taken seriously. So we've got to keep into our heads what age the woman is, and that helps us determine how serious this is, or it's something maybe that I can just monitor. So the next type of bleeding is heavy periods. Heavy periods are, again, really common in adolescence, so that it's, again, unlikely to be something that's sinister. However, obviously, I have a really low threshold to treat adolescents who have heavy periods because it may affect their schooling, it may affect their social activities, etc. If heavy periods are the case for a long time, then the girl, the adolescent, the woman can become progressively more and more anemic or have a lower and lower blood count, which can have knock on health effects. So, for that reason, it's worth checking out. Really common causes of heavy periods in adult women include fibroids of the uterus or adenomyosis. But again, abnormalities can occur. The concept that's really important here is the concept called a change in menstrual habit. So, adult women will have had periods for years, and a woman knows what is normal for her. And that's what we call a menstrual habit. I get a period every 32 days. The period lasts 5 days. It's heavy for the first 2 days. And that's normal for me, for example. Any deviation from this is a reason that potentially is of concern. And it's a reason why it may be worth going and checking things out with your doctor. The older a woman is, the more concerning a deviation from the menstrual habit should be. So, women who are over 50, certainly any deviation, they need to seek medical attention. Women who are over 45, again, any significant deviation, seek medical attention. Over 40, it depends on how significant the deviation is. So some things might be monitored for a while, because the other thing to say is that so many things affect periods. For example, stress. That's a common thing that can affect your cycle. Okay, the next is prolonged periods. So, periods, again, a change in menstrual habit. If your periods normally last 5 days and suddenly they're lasting 10 days, and maybe they're heavier and maybe they're a bit erratic, that's a reason to seek medical review. And again, if you're 40, I'd say definitely go along. If you're 45, absolutely do go along and be checked over, because this could be a sign of precancer or maybe cancer. Cancer of the lining of the womb, particularly, is what we'd be concerned about with these symptoms. It is less likely in premenopausal women, women before the menopause, and more likely after. However, it certainly does occur in women before the menopause. Precancerous cells can be treated effectively to eliminate or minimize the risk of them progressing to become cancer. So, women, the spotlight is women over 45, certainly women who are over 50. Bleeding between periods is what we refer to as intermenstrual bleeding. And there are several causes for this, and most causes are benign. So, most causes are not a concern or worry. However, this I consider to be a red flag, because, particularly if a woman has been having normal, regular periods with no bleeding between and starts to have bleeding between her periods, again, the older the woman, the higher my index of concern is. If this starts happening, then it's certainly worth a trip to your doctor. So, one of the causes of intermenstrual bleeding or bleeding between periods is cancer of the cervix or abnormalities of the cervix. Some are benign, like cervical polyps, which are easy to diagnose with an examination, but precancer or cancer of the cervix is a risk. For that reason, I encourage every woman to attend for their smear test when it's due. If you have bleeding between your periods, you should attend anyway. So even if your smear test is up to date, that does not rule out cancer of the cervix. So it is important to go along and be evaluated and have an examination and see what the cervix looks like. If there are any concerns, a biopsy can be taken, or you can be referred to colposcopy for further examination of your cervix. Bleeding after intercourse is another red flag, in that, again, if this is a new symptom, it's never happened to you, and suddenly you start having bleeding after you have intercourse, then that is a reason for assessment of particularly the cervix. Again, smear test, make sure it's up to date. If not, go along, have a smear test. And of course, in having the smear test, you will necessarily have an examination of your cervix and the vagina to make sure that there are no concerning lesions there. If there are, then again, biopsy or referral for colposcopy, where the cervix is interrogated more completely, may be indicated, may be sensible. If that starts happening, don't just assume it's nothing to worry about. In younger women, then the concern may be maybe there's an infection, maybe, for example, there's a sexually transmitted infection or a vaginal infection, which can be treated. We are particularly concerned in very young women because we know the risk of a sexually transmitted infection is statistically higher. And particularly if childbearing hasn't occurred yet, we know that sexually transmitted infections such as chlamydia and gonorrhea can affect fertility. So, this is not something that we want to leave undiagnosed and untreated because it can have long term effects on fertility, um, pelvic pain, ectopic pregnancy, etc. So, bleeding after intercourse, everyone who has that, I think, should go along to be evaluated. Bleeding after the menopause or postmenopausal bleeding. So, this is probably the biggest red flag because after menopause, women who are postmenopausal have a much higher risk of endometrial cancer or cancer of the lining of the womb. And this will usually present with abnormal bleeding. Any woman who is not on HRT, any bleeding after the menopause should be treated as a matter of urgency, investigated, treated seriously, and investigated as a matter of urgency to rule out cancer of the lining of the womb. And this is usually done by an ultrasound scan in the first instance, and or a biopsy or a hysteroscopy. And I've got a video about hysteroscopy which explains exactly what happens during the procedure and what the risks are and what your choices are around this procedure. So please view this if it is relevant. If a woman is on HRT, then again, we can't assume that the bleeding is due to the hormone she's taking, the HRT. We again have to rule out sinister causes for her bleeding. Some amount of bleeding maybe be acceptable within 6 months of starting HRT as you're introducing hormones to your body, or 3 months after changing the preparation. Any bleeding beyond this should be treated in the same way as bleeding in a woman who's not on HRT, meaning investigation should be performed. There's a higher index of suspicion in certain women. So, women who have an elevated body mass index have a higher risk of endometrial cancer. Women who have predisposing genetic conditions, such as Lynch syndrome or more rarely Cowden syndrome. Women who are diabetic, or women who have a history of polycystic ovary syndrome. So, these women should all have a lower threshold to go along if postmenopausal bleeding has happened, either on its own or if a woman is on HRT. And if you're on sequential HRT, then we expect you to bleed at the appropriate time, but unscheduled bleeding, so bleeding when you don't expect it, is what concerns us. And the last form of bleeding that women worry about is actually not too much bleeding, but too little bleeding, meaning long gaps between periods. Now, I mentioned before that the perception is that a normal period is 28-day cycle and bleeding for, say, 5 days. Um, some women, therefore, become quite alarmed if they have long gaps between their periods. So, again, age is all important. We do expect that coming up in the run up to the menopause, that periods will space out so that a woman who normally has a period every month may start to miss months so that she has longer and longer gaps. So she may have 2 months no period and then 6 months no period. And then eventually she works her way up to a full year of having no periods, at which point she is considered to be postmenopausal, and any bleeding after that is should be considered to be abnormal. Women of reproductive age groups, or premenopausal women, sometimes have long gaps between their periods, which can be a concern, and they come along for that. So, it is a little known fact that in order to maintain the health of the reproductive tract and the lining of the womb, particularly, women only need 4 periods a year. So you don't actually need 12 periods a year. You should have a period every 3 months. And, I consider that period to be like a reboot of the system where the lining of the womb is shed and then new cells start to grow. So if you are having at least one period every 3 months, then that is not a red flag. And that doesn't mean that there's a sinister cause within your reproductive tract. If you are having longer gaps, so if you're having maybe 2 periods a year or no periods at all, and to be clear, this is women who are not on any hormones. So if you're on the progesterone only pill, for example, or if you've got a Mirena coil in or a contraceptive implant in, then we expect that you may have no periods, and that is not a risk. It's women who spontaneously, they're not on any other medication, not on any other hormones, and they go long periods of having no bleeding. This needs to be investigated, and this is not a situation that really should be allowed to continue for long periods of time because that increases the risk of endometrial hyperplasia, overgrowth of the lining of the womb in the longer term, and endometrial cancer. Women who, as I mentioned before, have polycystic ovary syndrome have a higher risk of having long spaces, long gaps with their period, and have a higher risk of endometrial cancer and endometrial hyperplasia in the longer term if the situation is allowed to continue. So, for that reason, women with polycystic ovary syndrome should have either spontaneous bleeding at least once every 3 months or an induced period, or, for example, be put on the pill, which will induce withdrawal bleeds and therefore reduce their risks. So, the big red flags are bleeding before puberty should be investigated, really erratic bleeding should be investigated with urgency. Bleeding between periods should be investigated with urgency. Bleeding after intercourse should be investigated with urgency, and bleeding after the menopause, postmenopausal bleeding, should be investigated with urgency. Tell me in the comments if you want more details about any of these and what conditions can cause these. And I'm happy to do another video, for example, just about bleeding after intercourse if you want to hear more about it. Thanks for listening.